Thanks for joining us today. Welcome to the Center for State's video series on readiness. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. The Readiness Brief is intended to help child welfare agency leaders, managers, and stakeholders determine an approach to assessing readiness and understand the key factors that influence readiness. It does this by providing step-by-step guidance to examine readiness and analyze findings throughout the change and implementation process. In this module, we will continue our conversation about readiness by digging into how to develop an assessment approach. As a reminder, by now teams seeking to assess readiness should have reviewed and considered the factors that contribute to readiness before moving on to conduct an assessment and analyze findings. Before selecting a tool or conducting a readiness assessment, teams should take time to consider the following questions that influence an approach to assessment. The scope of data collection. What data does the team have access to already to assess readiness? Are there surveys, interviews, focus or discussion group records, or observations that they can use to help assess readiness, or will there need to be a period of data collection that occurs? What format and which tools will the team use to explore factors of readiness or answer the questions of interest about readiness? Who will the team ask to participate in the assessment? How will they ensure a broad and diverse representation in the results? How will the team analyze the findings and decide who they will share them with and what format to share them in? Teams may want to get help from agency data staff or research and evaluation partners to select appropriate approaches for data collection, sampling, and analysis of any data that is gathered or assessment tool that is used. Let's take a look at some of these considerations in a little more detail. Teams should take time to determine the scope of the assessment to be deliberate and strategic in planning an assessment that will provide comprehensive and sound information. Some questions to answer as a team include: how comprehensively do you intend to assess readiness? What is feasible? It helps to be as comprehensive as possible within the capacity of the team and organization. What are the readiness domains that are of greatest interest or importance? What questions about readiness are of the highest priority to learn more about? Is there a specific intervention selected already that more targeted areas will be more relevant to? Or is the assessment intended to be an assessment of ongoing general capacity? And what tools are readily available? Is there a targeted tool that will assess the specific areas of interest? Or for an ongoing general assessment, is there a tool that has been previously used to measure progress against? It helps to use existing tools, modifying them as needed to explore the important factors of interest. There is no single proven instrument available to measure readiness for implementation in child welfare that is applicable to all situations. There are benefits to choosing a tool that is relevant to the type of readiness assessment your agency needs. Those that measure a wide variety of factors can help to identify strengths and weaknesses in organizational capacity, while those that focus on just a few factors may help to explore areas more in depth. And consider the reliability and validity of the tool selected. The Center for States has developed the research-informed Change and Implementation Readiness Assessment Tool as a complement to the Readiness Brief. The tool is organized into 5 broad dimensions of organizational capacity and includes the factors that influence readiness as discussed in Module 2 of this series. The full tool is useful for assessing the agency's readiness for implementation of a selected intervention, while a subset of the highlighted questions address the organization's readiness for change. We will discuss more about this tool and how to use it in Module 4. To assess readiness in their agency, teams may decide to use one of the existing tools noted in the appendices of the Readiness Brief as is, modify a tool if appropriate, or develop a new one. Questions may need to be tailored to fit the characteristics and requirements of a particular intervention. When doing this, teams can think about the relevance, clarity, and specificity to select or tailor a tool to their needs. Relevance. Are the questions meaningful? Clarity. Are the instructions clear? And specificity. Are questions too general or too specific? By answering these questions together, teams can modify or adapt specific assessment tools to more comprehensively assess intervention-specific readiness. As part of the assessment process, teams will need to decide from whom to collect information. It is important to consider the following key groups: a representative cross-section of the organization, for example, managers, administrators, supervisors, and workers from different program and functional areas; key stakeholders, for example, courts and other systems, as well as family and youth representatives; and partner representatives, for example, partner community service providers. Broad representation of different perspectives and collecting enough responses to gain a representative sample are also important to all assessment approaches. Next, teams will need to develop plans for how to analyze the assessment results and to share findings from it, including who the findings will be shared with and how they will be shared. Including diverse stakeholders with varied perspectives in the analysis process can strengthen the team's understanding of readiness and the implications of the findings. If there is enough data, teams may want to look at the results of different groups by role or program area to gain additional insights, like whether there is strong support or specific challenges to overcome, while analyzing the whole selection of results may help to assess overall organizational readiness. Let's take a few minutes to hear about an example from the Washoe Family Search and Engagement Program Manual of 2016. In preparing to implement a new permanency initiative, Washoe County planned a readiness assessment to have a baseline understanding of their readiness for the change effort. They wanted the scope of the assessment to include key capacities and implementation drivers, such as the values and perceptions of readiness for change, and competency, organization, and leadership drivers. They selected a tool that they planned to administer to existing county and their partner agency staff, but realized that it did not assess potential barriers and culture and climate issues. So they modified their approach to include an additional survey to management and key staff members on these items. They plan to analyze the results with considerations for changes to staff responsibilities and shifts in practice, as well as clarifying the roles and responsibilities for all of the key positions that would be needed for the intervention selected. It looks like the jurisdiction has considered the factors that might influence readiness and determined their approach to assessing it. What do you think might be next? The next steps in assessing readiness will be to conduct the assessment and analyze the results. Let's take a moment to check in on what you've learned about how teams develop an assessment approach. How do teams determine the scope of a readiness assessment? By considering the comprehensiveness needed, what areas are of greatest need for more information, and what tools are readily available to assess. How do teams decide on a readiness assessment tool or modify questions if needed? By considering the purpose of the assessment and the need, and then adding or modifying questions based on relevance, clarity, and specificity to the need. How do teams identify participants and plan for analyzing results? By including diverse perspectives, collecting a representative sample, and developing a purposeful plan to analyze and share findings with appropriate stakeholders. Now, take this a step further by reviewing the reflection questions and practice exercise for developing an assessment approach in your readiness workbook to connect what you've learned to your own experience. Up next is Conduct the Readiness Assessment, the fourth module in our series on readiness for change and implementation.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P2332014000033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.